Hello everyone. So we're gonna do some carbonic anhydrase inhibitors. So let's look at the yellow one. So it's tubular lumen, right? Yellow track. So you got bicarb here and lumen of PCT. Sodium and your hydrogen exchanger apical membrane. H plus is transported back into the lumen via NaH plus exchanger. So H plus plus HCO3, HCO2, H2CO3. That's your carbonic anhydrase. So H2CO3 gives back H2O and CO2. Alright, H2O and CO2 enter the intracellular space, alright, via diffusion. Water is reduced by solids at PCT. Okay, then you got H2O again goes to form H2CO3 via intracellular carbon and carbonic anhydrase. Come back in again, so that's like that. So acetazolamide, what it really does is it goes against the carbonic anhydrase, all right? Prevents reabsorption of sodium, that's one thing. With bicarb, so there's natriuresis, okay? So bicarb stays in the lumen, causes urine alkalinization, spill alkaline substance on the inside track. And also another thing, there's sulfa drugs, so there's increased chance in calcium phosphate stones. Okay. So you got that, and may cause type 2 RTA. Yeah, we kind of know that. So because there's always going to be hypokalemia. An increase in like excretion of bicarb. All right. There's bicarb excretion cause normal anion gap metabolic acidosis. Compartment is the gray track. All right. Then what else can it cause? It can cause a decrease in production of like aqueous humor. So you can use acetazolamide even for like glaucoma. So it can also cause like a decreased production of CSF. So you get like an increase in ICP because CSF production is decreased. And I think that sort of like used for increase in ICP. Okay, if you really want to do it. Useful treatment and prevention of mountain sickness. So that's really what acetazolamide is known for. Let's look a little bit into mannitol. So it's osmotic diuretic, PCT again, descending loop of limb of Henle. Excess diuresis may cause late hypernatremia, so a lot of more sodium. This increased ECF volume may cause pulmonary edema. Okay, see the lungs are kind of like shown here, and early hyponatremia. All right, even though there's late hyper. So there's early stage is hypo, late is like hyper. And it's also useful in like if you want to increase intraocular pressure, so it draws water out of the eye. So there you go. There you got your drugs right there. All right. So out of that stuff, we can move on to loop diuretics, thiazides, and the others. All right. So we'll see you in a bit. All right. Cool.